All right, welcome back once again for our periodontic lecture. We left off rather abruptly on periodontal maintenance recall. These are periodic maintenance that are initially done every 3 months for our patients, but time may vary according to the patient needs. Each recall visit or recare visit should include the examination and evaluation of current oral health for their patient, including a full mouth periodontal probing, an assessment of their home care for plaque control, a scaling, root planing, and polishing if indicated, and if pockets remain, irrigation with some sort of antimicrobial agent for the patient. Any questions? Please make sure that if you have any questions at all, reach out to me, and we will have another lecture coming up to talk about periodontal conditions that go along with this unit and other treatment factors for how patients get into that predicament, if you will, of having periodontal issues in the first place, how they are combated. Please make sure you're looking at your module, doing your recall or your workbook questions, your online tests, and getting ready to study for your final exam for Perio. Have a good rest of your day.